ahead and get started. Ricky. So, welcome everybody. I'm going to call the Benefits and Organizational Development Committee meeting. This meeting's been posted in accordance with regulation. And I want to welcome everybody. So today we're going to go around and do introductions just to make sure that we are all familiar with one another and that we can answer questions, and we'll come to you all too. So you're going to wrap us up on introductions, but you will start us off, beautiful woman here.
Good afternoon. My name is Sylvia Gonzalez. I'm the Director of Family and Community Engagement. Good afternoon. Tanya Garza, Assistant Superintendent for Elementary Education.
Good afternoon, everybody. I'm Fernando Reyes, the Assistant Superintendent for Secondary Education.
Hi, everybody. Dan Gatsa, Director for Student Support Services.
Good afternoon, Debbie Stoggan, Assistant Superintendent for Human Services.
Hello everyone, Dali Garcia, Assistant Superintendent for Instructional Services. Hello, Elvia Loera, Head Nurse with Health Services.
Juan Manuel Garcia, Principal of Dr. Cano, Freshman Center.
Nice. Sounds good, sir.
Javier Olivo, Memorial Middle School.
Marcos Somoza, Harlan High School South.
Rebecca Baker, Board Member.
Belinda Reiniger, Board Member.
Veronica Carton, Superintendent, and a couple of things. Dr. Reyes, I'm so glad that you said I'm the Assistant Superintendent for a secondary and not the South Principal. You remembered that, so that's good. And then secondly, I want to say a special welcome to Mr. Almanza. He is actually doing a teacher externship with the Texas Workforce Commission and the County of Human Services team as part of his weekly activity. So welcome, Mr. Almanza.
Good afternoon, everyone. My name is Ida Abris. I am the Assistant Superintendent for Business Services.
I am Rachel Cortez. I am your Director for Employee Benefits and Risk Management.
I'm Scott Gibbs with McGriff. Sorry, I've got my full voice today. Benefits consultant, working with you guys.
We missed one person over here, but Spock, do you want to introduce yourself real quick?
Sure, Eladio Hammonds, Trustee.
Nick Sellinger, First Financial Account Manager.
Cindy McClure, First Financial Benefit Consultant.
And I'm Jason Walters, Regional Manager for First Financial for Central South Texas.
Super. Well, welcome everybody. Thank you so much for being here. So I'm going to check with Ms. Cortez on public comments for agenda topics.
There are no public comments.
Very good. Thank you so much. And so we're going to move on to the update on the district self-funded health insurance plan. Ms. Andres and Ms. Cortez.
Yes, thank you, Ms. Chairman, Board Members, Superintendent Dr. Paton, senior team, and members of the committee. Pleased to tell you today that we started this bid process here on our health insurance back in February 2025. And we do have Scott Gibbs who will be doing a presentation on our self-funded insurance. I am also to tell you that we are getting ready to close our books. And so we have our national auditors on site. They've begun doing their testing. They select a sample of some of our claims and do some testing there. Confirmation was sent out to Blue Cross Blue Shield. And then we'll get ready to do some accruals and get those reported. And we'll have a good solid audited financial report for the month of November.
Very good. Thank you very much. And then if you want to go ahead and continue then to discuss the ancillary groups like the funds.
Thank you, Board Members, Committee Member, Dr. Corton. And in February of this year, we had discussed with the committee about some items that were up for renewal, which was our dental, our vision, our critical illness plans, and along with our group plan. We worked with First Financial, who is here today, to go over those bid responses and the renewal for the vision as well. And I'm going to hand it over to Jason and to Cindy and Nick.
Very good. Thank you very much. I'm going to let Cindy just kind of start. We have you guys as part of a benefits cooperative. It's the Omnia Benefit Cooperative. It's the largest nationwide benefits cooperative. So First Financial has been tasked or awarded, however you want to look at it, as managing that cooperative in the United States. Of course, we're big in Texas and Louisiana, New Mexico, Arizona, and the Carolinas, and Virginia. So we manage a lot of groups under the Omnia Co-op, which gives you guys some extra value adds within your benefits and within your billing. So I stole all your thunder, so I apologize for that.
It's okay.
I think I did that because I know we are a little bit limited on time, and we don't want to take a whole lot of time, but certainly want to hit the highlights as far as what we've discussed.
And Jason, before you start, you do have the presentation in your packet. You have one that says ancillary products, and then the second attachment, it will be the group life.
Okay, so the first thing we're gonna look at is the dental. Part of the Omnia, when we do go out to bid for a product, when the product's coming up for renewal, or we're finding some concerns with a benefit that's in one of our customers' accounts, we wanna make sure that we're doing our due diligence to make sure we got the best things on the table for everybody. So, in each particular category, whether it be dental, vision, group life, a disability, a cancer, accident, critical illness, whatever it is, there are certain carriers that are awarded the opportunity to be part of the cooperative. So they have to make some concessions on their end to make it more beneficial for the employees to have these benefits. So there could be anywhere from 3 to 7 different companies in the market that have won the opportunity through a bid process to be part of the Omnia Cooperative. Even First Financial as the TPA, our services are bid out as well every 3 to 5, it's every 5 years.
The carriers are every 3 years, the
TPA every
TPA
5.
services are every 5 years. So every 5 years, they search for our services, and then we have to go through the bidding process to get awarded them.
And then the carriers every 3 years. So if we need to go out to bid for a product, every one of those carriers has the opportunity to present. Okay? So as you guys were part of the cooperative, some of our conversations with Rachel, because you guys have Voya as your group life carrier currently, Rachel wanted to make sure and give Voya the opportunity to step up to the plate and see if they could continue to earn your business. That meant that we then had to take the gloves off and we had to go outside of the Omnia. We had to give every Omnia carrier the opportunity, but we could also get outside of the Omnia, so non-Omnia carriers actually bid as well. Now, the good part about that is that the winning carriers were all the Omnia carriers, but some of the non-Omnia carriers were also they put a very good package together. But we were able to stay within the Omnia Cooperative, so that was good. The first one I just want to discuss with you is the dental. You can see across the very top whether they're Omnia approved or not. Of course, all the ones that responded were Omnia approved. Currently, you're with Emeritus, and if you look down that column, you'll see the pricing at the bottom. Okay? And the pricing, one thing about First Financial is we don't chase price. We chase quality of product, quality of service at a competitive price. Right? So we're not coming in just to bring you the cheapest product. And to support that, it helps take the pressure off the benefits office. So there's not calls coming in every week like, they declined my dental, or I can't get this because, and it just puts a lot of pressure. So we're looking out for a quality product with quality service and support in the background. With the Emeritus, even though they came in a little bit higher, and you can see the other bids that came in, one of the things that withheld our recommendation would be to stay with the Emeritus, and the reason is they have a program called Dental Rewards. So every time somebody uses their dental plan, they at least use their plan, but use less than $500 of the benefits that they're allotted, which generally is anywhere from $1,000 to $1,500 depending on the plan, then they get an extra $250 added to their calendar year maximum dollar amount to be used for dental services throughout the course of the year. So they currently have $1.2 million that have been distributed amongst all the participants in the dental plan. So there's a lot of participants on the dental plan that have upwards of $2,000 to go toward their dental services. So we took that into consideration. We couldn't get any of the other competitors to put anything like that together or make it beneficial enough to recommend that you guys change from that. So we do recommend that you stay with the Emeritus. It's still very cost competitive. It's a A-rated or better company, because that's all we're gonna work with, and that's all that qualifies to get into the Omnia. $1.2 million in dollars that have been spread amongst all the participants. So we do recommend that you stay with the Emeritus.
And Jason, just to clarify to the committee, we have about 700 plus members who have that 1 million. So generally, the annual maximum for dental is $1,000, so it could be that someone right now has a $2,000 maximum.
Right.
Based on the continuous carryover of that $250 per
Yes,
year. So
that's correct.
should we move over to another carrier, then those maximum rewards are lost.
All that would be lost. All the additional benefit rewards would be lost. Everybody would be back to either $1,000 or $1,000 benefit.
And as some of you who may have had a crown or anything major done, some kind of periodontal cleaning or anything extra, sometimes it does cost, even though you're a network.
Yeah.
So that extra money, some people build it up to get that extra service that they're needing to get.
Absolutely.
Committee members, do you have any questions on dental? We can do that before.
Basically, the waiting period for type 3.
Okay. No
One of the
questions.
other things that Emeritus threw in their plan was they took away the waiting period for type 3 services, which is, as Rachel was talking about, with a crown or root canal, where the major stuff is. They took away the waiting period, whereas it used to be 12 months, it's no longer a 12-month waiting period. So they're willing to be competitive to stay in here and continue to run their business. And you've been partners with Emeritus for a long time. On the vision, you did get a rate pass, and I think you're still under a rate lock for the vision, is that right? So, that we went through that process and didn't feel a need,
So that would be the last 2 pages of the report.
yeah. All right, the second page of the report talks about critical illness. Currently, you guys are with Aflac, which is a very good company, as everybody knows and hears about the duck. And it's worked well here, but it was coming up for renewal. And so we went out to the market to see what else might be out there. And we did get 2 other proposals back. We had, 2 other proposals, a Cigna and a MetLife. And although, as I stated, we don't chase price, you're basically just buying an indemnity plan, which is just a lump sum benefit in the event of a diagnosis of cancer, or in the event of a heart attack or stroke or bypass surgery, kidney failure, organ transplant, paralysis. There's a laundry list of things that we all want to avoid in our lifetime that potentially do occur in our lifetime. And that's where the dollar amounts of upwards of $50,000 can be paid to the participant or the participant's spouse, or a percentage even to the participant's dependents in the event of one of those critical illnesses occurring. We did find that Cigna matched the plan and came in less expensive. So we would recommend that, just because it's simply, like I said, you're just buying a dollar amount. The plan has been matched from what you currently have, and the rates have gone down. So just in an attempt to help save a little bit of money for some of the employees that have that particular plan, we would recommend moving to the Cigna plan as a result of that.
May I ask, any questions?
One quick question, does changing the plan create any friction? Is it a pain for the employees to have to change the provider?
Very good question. No. Typically, it's the product, it's not necessarily the name on the back of the jersey. So the transition from the current company to the new company will be seamless to the employee. They will be notified that it will be a new carrier, and they will receive new information from that particular carrier.
The one thing that we do when we have these RFPs that go out to the carriers is we normally require them to honor the employees that have already served their time on the plan. So if there's an employee that has a pre-existing condition, the new carrier will honor the already time served on those plans. so those are protected, so it's a no loss, no gain situation.
You referenced on the dental that you take into consideration whether or not claims are denied, or are there any concerns with that switching from Aflac to Cigna? Like accessibility for access?
No. No, we don't see any concern with that. We've worked with these carriers for 30, 40, 50 years, so we've got relationships with them, and anything that comes up, generally, you have a First Financial staff member here on site, Dulce Alcala, who resides here at the district, in the district office. She is a support for all the employees here, and she works closely with Nick and with myself as needed to make sure that anything like that is taken care of. Good question, because I know that's always a concern when you're changing carriers.
You mentioned saving, chasing dollars for quality. Is the quality of Aflac or Cigna comparable to Aflac?
Yes. We've had a little bit of trouble with Aflac over the last few years. And we have rebuilt our relationship with Cigna. And up to this point, they have proven to be as good or better than where Aflac was when it originally came into the district.
Can I follow up on that?
Sure.
Tag on to that question, can I maybe ask it a different way? As far as market penetrance, is it the same as far as providers and dentists out there? Is it pretty much accepted by the same, or is it a direct overlap, or are the folks who have to change dentists because of this change?
Oh, changing dentists? Well, we're not changing the dental plans.
Okay.
We're staying with Emeritus on the dental.
Okay, got it.
But like in this particular situation, because it's just a medical supplement, it doesn't run through your medical carrier. We're not looking for specific doctors or hospitals. It's just an ancillary product. So if there is a diagnosis of cancer or heart attack or stroke, claim is filed directly with Cigna or Aflac, or could be Met, or could be any one of those carriers, and they pay that accordingly directly back to the employee. Does not run through insurance on that. Anything else on that one? We did have a brief discussion about pet insurance. This has become very popular. The one thing about pet insurance that we've learned over the last few years is it's not really a payroll deduction. Generally, the carriers that are doing pet insurance, they can do it directly. The conversation went to where really wouldn't even be a discussion unless you guys wanted it to be something that basically we would put a flyer on your employee benefit center and provide the phone number, and if they wanted to call and add all their little puppies or cats or whatever onto their dependent slide, then they would do that directly with the carrier. So, and it would not be a payroll deducted issue, or a payroll deducted item. We also found out by implementing some of these and doing a payroll deduction that out of a 4,000 man group, we had one person that took it on payroll deduction. So we didn't really feel like, but again, we do have a lot of our customers that like the idea of having pet insurance and have asked for pet insurance, and it can be provided, but the way that we would provide it is simply have a flyer with the carrier, the phone number, and then we would send that carrier the basic census of who's here in Arlington CASD, and then they go for Arlington CASD, and then they'll get a discount for their fur babies.
And if I can add, Jason, one of the reasons we want to do direct bill to the employees, because the companies were wanting a percentage of participation. And since this is new, we couldn't guarantee the percentage, so they wanted like 200 or 300 employees, and we could not guarantee that. So just to open it up and see where we're at next year, we can revisit, and if we have that many employees, definitely we can want your reduction for that to make it easier. Because we talked about, there's no limit on the age of the pets, bird, the lizard, and all those other things we talked about. So it got kind of lost there, but we thought it was going to be a good add-on benefit for staff.
And again, if you guys decide to go down that road, we've got a couple of companies that they're in the Omnia. We can just throw a flyer out there and then allow them.
But the recommendation, I think, is going to be with
Nationwide.
Nationwide.
Correct?
Yes.
It's a lawnmower company, and it's large.
They cover live mascots.
And just to recap, the renewal for the Vision is gonna stay as is.
Yes.
All benefits stay the same, same
Correct.
company.
That's correct. Vision, no changes, rate cap continues, everything's the same with Vision.
Any questions on the last two, pet insurance service?
Okay.
Just have one more item, which is gonna be the group life, I'm gonna go over that, and that's all. Now, the group life, the district pays the first $10,000, and the additional $10,000 if it's accidental death. Anything, above that, the employee can pay, you know, either an additional amount or for their spouse or for their children, under 26.
Yes, 25 or less. Yeah, so that's the big one. So we got the most bids on that one. And we got a few non-Omnia bids as well. So, and although I don't want to take anything away from the non-Omnia companies, they were very aggressive in their approach to looking at the plan and providing a quote. And we did give Voya the opportunity to come back with a more competitive quote. And because they were coming in with a little bit of a rate increase, at the last minute, they actually came back to us and said that they waived the rate increase and locked the rate and all that. The unfortunate part of that, and we've appreciated the relationship with Voya over the years as well, and they've been a partner with you guys for a long time. So we definitely, I appreciated Rachel stepping up and saying we want Voya to have an opportunity, and we respected that, and they did the best that they could. However, as you can see, there was a lot of very competitive bids that came in. I'm gonna go straight to what our recommendation is, and just tell you why. So basically, all the carriers match the existing plan that was in place, but some carriers have a little bit more value adds, and in this case, Standard, from a voluntary perspective, and I'll get to that on the next page, increased their maximum guarantee issue, meaning no medical questions when somebody first applies for coverage as a new hire, and not just first applies for coverage, but first applies as a new hire, can get up to $50,000 additional than what you guys have currently for you. But as far as everything else with your basic group life, the rate, again, not the least expensive, but certainly very, very close. But they had a tremendous amount of extra value adds, which I have some information on that I'm happy to share with Rachel. If you guys want to see what those are, you can see what those are.
One value add is the age reduction. Traditionally, when an employee turns 70 or 75, it reduces by 65 or to 65%. Standard waived the age reduction, so the employees that sign up for a certain dollar amount, it stays at that dollar amount until they decide to separate from the district, or, you know, heaven forbid something happen, but they will have the full value that they sign up for without any age reductions, which is a big incentive.
They did also provide a 3-year rate guarantee. And based on the numbers that we ran, just kind of a quick calculation, it's saving the district about $20,000 annually just on the basic group life. So it was over 50,000, which is where the cutoff is to have to officially go out to an RFP when it's that kind of money going in from an employer. You were close to 60,000. It's coming in at 42,000, give or take, based on what the active participation is of employees at the time. But came in about $20,000 less. Okay.
So Jason, if I can clarify with me, Cindy, right now, anybody who has $150,000, because that's the guaranteed issue when we first went with Voya, during the open enrollment period, we're going to allow them to do an additional $50,000.
Correct.
So they can, with no medical questions asked.
Correct.
So they can, somebody, example me, if I have $150,000, I can be up to the $200,000. I don't have an answer to medical question here, no blood work needed. And so that would be during the open enrollment period that we'll be offering that to employees.
Yes. So we do recommend going with the standard for basic life, which is the employer paid part. they wouldn't be able to put an offer like that together unless the standard was also the voluntary life option. And they matched the plan. We had to go back to them just to clarify a few items relative to what Voya had, and they made that more clear, which also gave us confidence that it was matching the plan that was already in place. And it did take the guarantee issue up to 200 from the 150, which is what is current. And as Rachel pointed out and asked a minute ago, they will be able to get that extra 50,000 guarantee issue if they choose to do that. And they match the rates for the employee and the spouse and dependents on a voluntary basis for anybody that wants to buy in on that particular product. Yes, sir.
But to get the 200,000, they have to have 150,000, correct?
Correct. Yes. Yes, they have to have the 150 already, because with guarantee issue, they have to do it within their 30 days of their hire date, unless there is, down the road, unless there's an actual open enrollment that occurs from a voluntary basis, but, yeah.
But if they're at 50, they can go up to 100. Because we're doing the 50,000?
50,000 guaranteed,
50,000
guaranteed above and beyond
above
everything.
and beyond, 50,000 above and beyond, not to exceed the 200. Yeah. So,
Any other questions?
any questions on that?
And these two, the ancillary plans, along with the vision renewal and along with the group life, the term life, the voluntary term life, those are action items for tonight. So they're presenting this information again to the rest of the board.
We'll reserve our multiple questions for that.
Yeah, that would be best here, actually, but no, however you want to do it.
Yeah, but seriously, if there are any other questions before it comes up, that's enough.
Yes. Anything at this point?
All right, thank you very much.
Thank you very much.
All right, Ms. Ambrose and Ms. Cortez, will you continue to discuss the health insurance food response health plan design?
Okay, so tonight we do have Mr. Scott here with us today to present to you the health insurance bid responses, as well as possible health plan design and information on health insurance. There's a loaded presentation for you.
Yes, while we're loading, we have a few folks who came in after we did introductions. So, Mr. Tapia, I'm going to start with you, and I'll try to pick up everything. Please.
To the whole group,
Yes.
Oscar Tapia, Assistant Superintendent for District Operations.
Danny Castillo, I'm the Director of Emergency Management and School Safety for the district.
Diana Hale, Memorial Middle School. Rachel Martianovich, Harlingen Collegiate.
Thank you. Sorry. Did I miss anybody else? Very good. Okay, Mr. Gibbs, you're up.
All right, well, I'm here today, we're gonna talk a little bit about kind of where we are on claims through May. June claims dropped today, so my team will update this once we download the Blue Cross reports today. We'll talk about the RFP, the results of the RFP, and talk about kind of where we are looking at the fiscal year budget, 2025, 2026. So we'll look at the medical claims, I'll give you an update on the RFP. Also still have some information in here regarding TRS and how we can compare to TRS. Also going to spend some time talking about, we've had a lot of conversations around advanced primary care clinics and kind of what they do and how they're paid for and what kind of savings the district could potentially realize from offering that. Then we'll talk about potential plan change options and then the recommendations and potential plan changes that will go probably to the August 5th school board, so there won't be an action item tonight. So looking at the claims through May, I think what you can see is, our gross medical claims are up about 12.1%. Less the stop loss, our net medical claims are up about 7.9%. Our pharmacy claims are up 20%. I will say, late last week, started doing kind of a deep dive on that. You know, we have seen an increase in GLP-1s, but what we also found out, working with Blue Cross, that they actually miscoded our benefit for January. And so whereas weight management drugs were to be excluded for weight management, they actually checked the wrong box. And so they have been including them. So as of last Friday, they fixed the glitch. And the district should be, I'll know probably later this week, the total amount, but it's probably going to be somewhere in the neighborhood of about $800,000 that will come back to you guys. Also, when I redo the projections, it will alter the projections because these claims were in there, so it will also, also lessen those. And then also we had, in May, we had a claim that Blue Cross paid. It was about a $625,000 claim. It was from 2022. And so it was an in-network provider. Because the way they paid it, it fell outside of our reinsurance. However, I had a very nice conversation with them that basically that they needed to figure out how to reimburse you guys the amount above our stop loss of $275. So they agreed to do that. So it will come in the form of a credit probably within the next 60 days. So the good news is we're going to probably have a little over $1 million that's not reflected in these claims right now. And before we present to the committee and the board in August, I'll have all these numbers updated as well. And I'll circulate them well before the board.
Yeah.
Question, rewind back to the pharmacy.
Yeah.
The GLP-1, so.
And I have some detailed slides in there in a second on those.
So our policy is that it's only for weight.
Yeah, so.
We're not for weight.
Right, not for weight control. So our GLP-1s, it falls in line with what Prime Therapeutics
For diabetes management.
does, yeah. And it falls in line with the way I always look at it too with the carrier. It's like, okay, what are you doing on your fully insured business, right? Which that was one of the comments I made to them about that claim being paid. I said, if you guys would have been on the hook. But, so it is, and you'll see on one of my slides, so there is a protocol on the GLP-1s. And it is you have to have a type 2 diabetes diagnosis, and your A1C has to be in excess of 6.1. So, and I'll tell you that 95% of my clients now, that, especially public entities, that is the way they do it. I still have a few that pay for it, but they're getting out of that business because it's become, from a weight management standpoint, the claims have gone crazy. So, so Blue Cross is, and Prime is managing it through their protocol, which again is, is the way that.
Has that always been our policy, or this year?
No, that's always been our policy. And as far as weight management goes, we never intended to cover weight management. And actually, when I even went back and looked at the paperwork was very clear that we were not covering weight management. And they just, when they were loading in the data, there was a yes/no box, and they checked the wrong box.
Have they made that mistake in years past? Is the GLP-1s have been?
Yeah, no, they haven't made that mistake. I think a couple of years ago they made another mistake just on another form. But as far as the GLP-1s, when we look at it, you guys are not uncommon from most of my other groups. And because when you look, most of my other groups, 3 out of the top 5 drugs on spend are gonna be typically, you know, Ozempic, Mounjaro, Jardiance. So, and again, I think that there's a continual situation. I think they're monitoring these drugs continually to see, you know, if, to see if, a generic form will come available or things of that nature. So, and that's kind of where, when you look at the pharmacy spend, so you can see right here, this is always kind of what I look at, and this is cost per script, okay? This is the number of scripts divided by the total cost. So you can see ours is up about 16.88%. But of that 7,670,000, about 800,000 will be coming out of that. So that 16 will probably go down to probably less than 10%, which is, industry standard trend right now on pharmacy is probably about 10 to 12%. So we'll actually be under that number. So looking at this again, you can see, number 1 is Mounjaro. We have 356 claimants, about 1.2 million. You've got Ozempic second at about 636, and then that Zepbound right there is the drug that will come off of this. There's also Wegovy down here. There's also one other drug, but it's not in the top 25. But you can see, so 1 and 2 are the GLP-1s. You get to Stelara at 4. That's a plaque psoriasis drug. You'll see that's a massive. That drug is advertised on TV every night. It's Stelara and Skyrizi are anti-inflammatory drugs. Humira, again, an anti-inflammatory drug. Trikafta is for cystic fibrosis, which is a very rare condition. You've got Paxlovid, the COVID vaccine. So again, this is very common with what I see with our clients, especially in Texas, just because there is such a prevalence of type 2 diabetes, in Texas. So when you look at our budget sheet, so if you kind of look, you can see at the top here, we've got enrollment, we've got all of our expenses here, costs, and then fixed costs, and then we have our contributions down here. So, as you go over, currently right now, without June claims, we were about 855,000 in deficit. So, depending when those claims get pulled out for the weight management, we're going to be probably running right even, maybe a little bit in the green. But with that, that's good. But what it means for next year is because you still have, trend. So it's the situation of where, how do we moving forward? Look at that. So when we look at our fiscal year projections, we are estimating that, we're probably going to be closer to this 23.7, which puts us at kind of a deficit of 1.8. That's really going to be closer to $1 million, maybe a little less than $1 million, with the credits coming back. So that's really kind of where we're gonna need to focus to try to find that. So, and we'll talk a little bit about that here in a minute. So when we did the RFP, we went out. We had quotes back from Aetna and United Healthcare. Ultimately, at the end of the day, there was really no financial rationale or reasoning to leave Blue Cross. So at the end of the day, UHC was competitive, but at the end of the day, Blue Cross did have the best offer, and I know that employees have been happy with Blue Cross. So my recommendation and staff's recommendation When we look at us versus TRS, right? So you can see 2024, 2025 funding, you know, when you have our reinsurance. So overall, our total funding is about 22 million. When you look at our projected costs, we're about 22 million for 2024, 2025. And then 2025, 2026, we're at 23.5 million. But because TRS's plans are worse than our plans, you have to make an adjustment, and the benefit load is roughly about 27%. Our plans are probably 27% better than what they offer. So when you load that up, I think you can see that that for 2024, 2025, we're still doing better than we would with TRS. And for 2025, 2026, we're still doing much better. So, you know, we'll always continue to monitor that. But it, you know, right now, I think the plan is doing good. I think we just need to, you know, probably, you know, there might be some changes we need to make just to, you know, just to get some cushion in there. So one of the things when the RFPs came in, we did receive a quote from a company called Frontier Direct Care. They're here in Harlingen. They provide advanced primary care clinics for their clients. So, you know, basically what happens is they have clinic locations throughout the valley. They, very nice, I toured them. And so, you know, so essentially what advanced primary care is that we give the employees access to these clinics at a $0 cost, okay? And so they would, you know, in an advanced primary care, the primary care doctor can handle about 80% of the lifetime needs. With them, there's no wait times. The way they schedule, there's actually no waiting rooms. You just walk in, you know, and you go. It's different than like going to a Blue Cross primary care physician, where, you know, they need to turn every 15 minutes to see another patient. You know, when you have a concierge level clinic, they can actually spend 30 to 45 minutes with each member and provide that level of care. They also have Frontier Direct Pay. So what they do there is anything that's referred from the clinic, whether it be like an MRI or things like that, they have standard rates in place with some of the facilities down here that actually it's a less cost than what you're getting with Blue Cross. So for the member, they would not come out of pocket, and then it would, you know, it would be charged to the district. But for instance, whereas on a Blue Cross contract, you might have a MRI that's at $1,500, their contract may be $300. So for the member to go to that, for the member to, and the way they do it is it is a direct electronic payment. So with that member, so with that provider, they immediately pay them within 24 hours, so they don't have to chase the money. So at the end of the day, that member gets that service through them for free, and then the district would save the additional $1,200 on the backside. So, you know, and as I'm talking about this today, you know, I know several of the board members have had questions and talked about this, and I think we probably need to have Frontier in to meet and talk with you folks. They also have their RX program, so they will actually prescribe generic drugs at no cost to the employee, and they actually will do mail order medications that come right to the clinic within 24 hours, and the member can pick that up. So, you know, what does it mean for an employee? You know, for the clinic wait times can be up to 3 hours. Duration of visits typically 15 minutes. You have to pay the office copay. You have to wait on your lab results, and they do all that in-house. And so At the end of the day, they're, you know, it is a benefit to the employee because it is a $0 copay. So you go in there, and then, you know, the physician, the physician that sees you can spend time with you and can really help you and diagnose and really provide a higher level of quality of care. It, so, you know, and it really, where their locations are, but it looks and feels like it's your own clinic. And one thing I always look at when I probably have 15 different clients that have a clinic of some type, on-site clinic. One thing I always look at when it comes to different companies is I want to know, the one thing that I really focus on is, do they keep their providers? That's the key. And I will tell you, Frontier does, another company, Medici out of San Antonio, they do a very good job of, keeping their providers. So the member journey, you go, you visit your Frontier primary care physician. It's a walk-in clinic. It's very, they're very nice and comfort and slick. And they don't feel like a clinic. The PCP can spend 30 to 40 minutes with you, talk about any of the health needs that you have. They also will help you get a referral where you need to the right specialist. And then they do a really good job of aftercare, following up, making sure that if they gave you any recommendations, that you're following those recommendations. So this is kind of how it looks. It's a house, right? And they're in the front of the house, and then they're going to guide you, through the avenues for you to get your health care. And they work with City of McAllen, City of Brownsville, and they've seen a tremendous amount of bending the trend curve to a negative trend curve. They also have Leander ISD. So and how it works, so again, this is their heat map. These are where all of our employees are. The red is where their clinic locations are. So they have pretty good coverage. You can see here, where we've got our members spread out, and they have coverage there, and they're open to, if the district wanted to build a clinic or have a clinic in a different location, they would be open to potentially doing it. So when you say what is the price, so they do have a price. It's a PEPM basis based on the tier. Now,
And Scott, just to
Yes.
clarify, PEPM is per employee.
Per employee per month. So the way you have to kind of think about this, because this is, so we've got our claim bucket, right, that we're paying Blue Cross. So when a member goes to Frontier, that claim does not hit our claim bucket from Blue Cross, okay? So we're diverting that care to here, and then we're paying Frontier, and Frontier will guarantee the savings, but in addition to that, they feel like they're doing a better job of when that claim is running through Blue Cross. So instead of being a net, a net on the budget, it's actually a net negative on the budget, because that's how they come up with savings. And I've given them claims data, so the numbers you see here, and I'm an underwriter, and I've checked their numbers. They do believe that that if they're engaged, that they will provide an 11.4% savings, which is almost $3 million.
And Scott, to clarify, the per employee per month, 'cause I know what that means,
Yeah.
but it's regardless of the
Yeah, no,
employee goes to
it
the
is,
clinic or
right,
not.
no,
It's the count of how many employees we have in our district.
Yeah, it's just like with Blue Cross right now. We pay Blue Cross an amount, whether employees use it or not.
Right.
So that is, that is
So
the way it works.
the annual fee, I just want the committee to be
Yep.
What would the annual fee be for, if we're looking at
Yeah,
the?
I'll show you that in.
Can I ask a quick question? I'm very sorry, maybe I don't explain it. Are we looking at this in lieu of Blue Cross Blue Shield
No.
or an additional option?
This would be a bolt-on on top of Blue Cross.
Thank you.
And that's what they do at McAllen and at Brownsville. Blue Cross is the TPA, and they sit on top. So the way it works is, our projected claims spend roughly about 25.8 million. So 18.25 $18,295,000 on medical, 7,582,000 on pharmacy. So through just the Frontier Direct Care, through our patients, not going through Blue Cross, but going through them, through their referral, through their quality, they expect to save 3.5 million. Through their negotiation area for Frontier Direct Pay, they would anticipate about 1.4 million in savings. And then through the way they do the pharmacy there, through the mail order, it's about 1.1 million in savings. What, 5 minutes? Okay, 5 minutes, sorry. So at the end of the day, when you look at this, so currently our claim spend would be projected at 15.8 million. When you factor the discount and then what you pay Frontier, it's really closer to 22 million. It's about $3 million, a $2 million difference. So they also have a program they partner with National Telehealth Solutions. And National Telehealth Solutions has set up a telehealth mental health program for students, for K through 12, for students and families. So one of the things that they have partnered with them is that if you do partner with them and National Telehealth Solutions is put on top of it, there is grant money out there potentially that could offset the cost. So what National Telehealth Solutions does is they provide services. So they provide services for students and their families regarding mental health services. And they have 10 avenues that they can connect in. And I should have said their goal is really engage students and improve access to quality mental health support, deliver frictionless care for conditions across the mental health continuum, and to have a measurable impact on the health and well-being of children and adolescents, and mitigate risk and provide additional layers of support for school districts. So this is something that you could potentially offer to your students and to their families. And with that, there is funding dollars out there, and National Telehealth Solutions and Frontier will help fill out the paperwork to get those grant dollars. Okay, and so this is kind of what it would look like. So it would be right here. They would complete a questionnaire for the grant. It would, they would, the board would agree to that, and then it would go to the negotiation, and then if they got awarded the grant, it would, that would be the amount of time for the grant to actually fund, okay? So, at the end of the day, what I wanted to show here is there is an option for their clinic to be funded through grant funding. But in addition, I'm going to go right here because I think this is a really good slide. So this shows you first year, okay? So the top is, this number one is if there was no funding, right? So at the end of the day, our projection would be 25.8 million. With Frontier, our savings would be 6,041,000. If you pay Frontier, remember, we're diverting claims from here to here, so we would pay them $3 million, about 3.1 million, but that would take our budget line item to 22,859,000. So you would see a savings of $3 million. So so it all kind of is within the claim spend. Now, if, for instance, we did get some funding, but the funding was delayed, they have provided this example of a better. And so you can see where we start getting some of the funding here. And then at the end of the day, the savings is actually 3.9 million. If we were to get it funded from the start, the cost, the 3.1 million would be funded by the grant, so the district would realize a savings of about $6 million. So today is just wanted to introduce the concept. You know, because I do think there is value to this. And I think when looking at the budget items, I think there's value for several reasons. I think A, it's a great benefit for your employees. I think B, it provides better quality of care for your employees. You know, it takes away a barrier. For instance, maybe you've got one of your low wage earners, maybe janitor or somebody, and they don't go to the doc because they don't want to pay $25. But they go here all of a sudden for free, and then they realize maybe they're hypertensive, right? They're about to have a stroke. Then I think also too, with the National Telehealth Solutions funding, you can actually provide a benefit to students and their families from a mental health standpoint. So I think there's a lot of value, and I think it's you've got to think about it from you know, you're basically putting them on top of Blue Cross. You still have the same amount of dollars, but if it goes through them, that there's savings. So I just wanted to kind of introduce that concept real quickly. These are our current benefits. This is going to change with the claims data and the ones, you know, ultimately right now, we'll probably need about $1 million. If June claims are better, we may not need that much. But what we've done here is we've put together a few options, you know, to get there. But some of these, we originally were thinking we had to get to 1.8, but in lieu of the stuff that's happened over the last 24 hours, I'm sorry I could not take this, but you know, I think we're going to be less than that. So instead of doing all these changes, I don't think we would necessarily have to do all those changes. We could make a couple of minor changes to get us where we need to be. You know, and I take this very seriously because I know that the legislature had some money for raises and things of that nature. And what I don't want to do is I don't want to say, hey, here, you're getting this here, and then I'm in your pocket over here because, you know, we're lowering your benefits or doing that. So I will, as soon as I get, probably the end of this week, but I'll, into next week, but I'll have this updated. We'll have a good view. I think, again, I think we're going to be a lot better. I think we're going to probably be at 800 or 900,000, which, you know, is probably like a 4% increase. So I think that's good. So these are, you know, so when we come, this is what it'll kind of look like. I would think though, depending on the number we have, we wouldn't have to have all of these changes. But one option we talked about was just having one plan, doing away with the high plan, because we really don't have that many people on the high plan. Option 2 would be to keep both plans and just kind of make some changes. Option three could go with either option 1 or option 2, but it would be to potentially look at putting Frontier Direct on. I think if you did that, if we vet them and everybody's comfortable, I think the potential, I don't think you would probably have to do any changes. But the nice thing too is there's cushion there to rebuild the reserve a little bit. Because, you know, right now we're pretty much just, you know, on a cash basis, so.
And so this is not an action item for tonight's meeting. This is just for us to review this information and have questions.
I tried to do my best.
And
that's a lot of information.
And so we can look at health plan design changes. You know, I know what Scott had said, not wanting to increase rates, but that could be another option that we could consider as a committee. You know, have the increasing the rates, maybe have employees pay an additional $10 to $20 a month. I don't know, I'm just throwing a number out there. Or do the 4%,
Yeah,
or.
$10 a month, $10 a month, 5-pay period equates to about 330,000. So if you did 20, if you did 10 and 10, it equates to about 660,000.
And that's not our recommendation, we're not recommending
No,
anything
it's just,
right now. We're just discussing, you know, bringing up ideas, because we are going to be in a deficit of $1 million. And so how do we get there without impacting staff, minimal impact to staff and benefits?
I just wanna stress that all of this information, and this is a committee meeting, and we won't have an action item on this. Here's kind of what I wanna share with you all. First of all, if you look at all those three options, it's to continue with our services with Blue Cross and Blue Shield, that's the first thing. Secondly, we did ask Scott to bring us recommendations around a zero impact to our employees, because we realize that that's gonna be a priority for us moving forward. I also want to go back and address the question that Emily asked, because Frontier is not the third option. In the event that we explore that, it would be an option for employees, not the option. So I just wanted to clarify all of that.
Yeah.
And we certainly want to make sure that we stay connected with our organization around this. That's why we're having this meeting. Like I said, I really want, as you all exit from here today, I wanted to make it very clear, like those three options that we're looking at to be presented, doesn't come into three, nor does it say that Frontier is going to be the option for one of those. So our plan is to move forward with Blue Cross Blue Shield for next year. So I just wanted to kind of share that with you all and clarify that based on your question. I don't know if our board members want to add anything else.
I will just jump in that I think that today was a good, lot of information, but it's good to give it, to us now. We will meet again, I would think before the next board meeting, because we have to have real numbers and more discussion. So please be thinking about the questions that you're asking, in preparation for this meeting as well. We asked lots of questions and wanted to make sure that there's no cost impact monthly to employees. We want Blue Cross Blue Shield to be there, and then there's lots of questions about some of these other options. So more to come, with more exact numbers and probably lots of questions.
I mean, maybe possibly get some feedback also from the committee members here. I think that would help us as well to, you know, that way we can feel comfortable as to what direction we want to move forward with. Do we want to move forward with maybe having that add on to the Frontier, or do we want to stay with the Blue Shield?
And you all know, those of you that have worked with me, I think everybody around the table has worked with me for a while. And you know that I always like to get your questions, right? I want you to think about, like, everything that we talked about today, and send us your questions. Because for me, understanding your questions and being able to clarify where we need to, that's gonna be critical. And in addition to that, then we'll have another committee meeting like this, so that we can come back and revisit more, a little firmer with the numbers, and everything that we've looked at for today and in the future, we can come back to this committee. Yes, sir.
I might suggest, I mean, I don't know if we'll be able to contact, but, you know, I think for something like this, I think a lot of those are questions about, you know, what happens to costs, utilization, you know, insurance, utilization is the same, it's gonna go up, who's gonna have an impact on the cost of the district, and CDC says, oh, we all save all this money. I think we have to do projections and see, because we don't know utilization. And then the other thing is, just to make sure the impact on cost of the district, impact the choice for our employees. I would suggest whoever the point of contact is for the district, maybe between now and next meeting, would love to have 40 email, not 40, maybe it is 40 email questions sent, and you can have like maybe an FAQ document, you know, before, you know, emailed out to this committee before the next meeting. Otherwise, it's going to be a long meeting. It's fine a long meeting, but I think it's be helpful because folks will have email right now, it's fresh in their mind. They might have 2 or 3 questions they want to ask. They they can hit send and email that, and then we can do an FAQ, and you can help with the responses.
Yeah, and I'm glad, and I'm glad to share that with Frontier and get their, what they, I'll do my part, but, get responses from them as well, as to, how it works. And that's, because I do think, I think they do a great job, but I would really like for them to potentially meet with some board members, because I know you guys are gonna have a lot of questions, and
Scott, I'm gonna interject really quickly, because I do wanna go back to the concept of open documents. And for me, Rachel can be that point of contact. But think about everything that you learned today, separate and apart from just Frontier, just as in general, questions that you have for all of it, because these are important things for our employees. And the reason that we have this committee is so that we can get feedback from our employees. So for me, like I said, Rachel is your contact. Send her your questions, and we'll continue that communication, because this is an important decision for our employees. And like I said earlier, one of the expectations, and as we have visited with our board, is thinking about like how do we move forward without an impact to our employees, because we realize that that's a priority for us. So think with, I don't know if there's anything else on our agenda.
Nothing else
down here. So at this point, like I said, please send us your questions. That strengthens the way that we can service our organization, and it'll certainly help us to answer your questions. Send those to Rachel, and then we'll continue to have dialogue.
Okay, and Dr. Reniger, just to clarify, there was one about the health insurance rates. But but we addressed it in that. It's just there for your information as employees to see where we're at right now. Should you have a question of how much, and it's just posted on our employee benefits website. But I wanted just to have that readily for you all to look at that, and, like I had said earlier, one option could be, have a rating, where we're at now. And that's not what we're recommending, but just so you can see where we're at and the impact that would be.
And if I may, before I adjourn this, my mind suggests, like, oftentimes this meeting is right before the board meeting where we take action. On this, I wonder, so please react to this, do we need it to be the week ahead of the board meeting so that if you have more questions, we can get those answered before we move to action, rather than an hour ahead of time? So I'm seeing nods, so, okay. So please, that could be our,
We have our
yes.
committee meeting date on I believe it's the 5th of August, and so we can add
We
there.
could potentially add it here. Okay. All right, seeing no other, thank you, Mr. Gibbs, thank you, to our whole team and our benefits group here, and thank you, colleagues, for being here. We are officially adjourned. Thank you.
For those of you that are gonna join us for the policy and audit committee, we're